name is Suluk Batargaliev. I'm SRHR coordinator at the Eurasian Coalition for Health Rights, Sexual and Gender Diversity. This is a regional coalition based in Estonia, Tallinn, but we are working in Eastern Europe and Central Asia, and everyone is located in different remote areas. For today, I'm here with you from South Korea because I'm currently pursuing my master degree. Okay, let's start with the presentation. I just want to make sure that everyone can see, and yeah, I can see my presentation also on the screen in the background. I was asked to do efficient models of HIV prevention among youth in the Eastern Europe and Central Asian region, and I really immediately thought about two things. It's about comprehensive sexual education, and it's about sexual and reproductive health and rights. So, the previous colleagues also show you some numbers, right? It was numbers of new HIV infection in Eastern Europe. They said that it's increasing. Unfortunately, we have this trend from 2000, 2010, 2023, and now in our Eastern European and Central Asian region, the growing epidemic is growing. Also, we see the more numbers on number of new HIV infections among adolescents and young people, for example. As you can see, it's also steadily, I wouldn't say growing, but it's still keeping really high. So besides of these all numbers, figures, and statistics and reports what we have, I want to really discuss and reflect with you key issues regarding the comprehensive sexual education and also regarding the SRHR. So what is the problem? First of all, we should acknowledge that we for today have a quality rating of sexual education receiving. For example, in this slide, you can see internal report of the EECA, which we made in preparation for our biggest research conduct currently going on, and I'm as a chance advertising among all of you to go to the link I will share later and also to participate in our research and give more evidence-based solutions. So we hear from young people and adolescents that quality for today on sexual education is very not good and not bad, it's a fair. When we talk about the quality, it's not only about how you are receiving sexual education, but what kind of topics you can also you are covering in these sexual education classes. Can you please raise a hand, and Andrei will help me. Can you raise a hand who received a sexual education in their school? All? No?
No, there
are
few hands, not so many, look, yeah.
Oh, yeah, thank you. Not so many. So we can see even from the audience that not all of us can get a chance to receive sexual education, which is comprehensive and which is should actually cover age-appropriate, culturally appropriate, and also relevant decision, evidence-based information about our sexual life, about our reproductive rights, about reproductive health, and so on. So we also ask our audience, in the research, how adequately of current comprehensive sexual education materials is serving the needs of LGBT young people. And as you can see, they are not very adequate or not at all. So this is a high proportion, which means they are also not inclusive at all in their perspective. Another thing, another question to the audience. Please raise your hand if you receive sexual education through social media. You are using Instagram, TikTok, websites, and everything, when you need something regarding your sexual health. what is STI, what is HIV, etc. Can you raise the hands?
I think there are more hands now. Yeah.
More hands, yeah, and this is also today's reality. I believe most of the participants is young people, right? So it's students, and the age of our the wave of adolescents and young people using usual source of information is a social media, online forums. Some of us could also receive education from NGOs or community groups, peers, books, etc., etc. And also we ask our participants preferred format of CSE delivery, and most of them, like half of them, outline digital platforms, and half of them also, like more than half of the more than 80% of people highlighted that social media and digital platforms will be key and essential. So what I want to take here, one key insight for all of us who are sitting here as representative of UNAIDS, representative of UNESCO, UNFPA, other different donors, international organizations, academia, future professors, etc., that digitalization, and also as it was reported from US previous speaker, digitalization is a huge and global part of our development, and we should make more and more investments on creating and developing resources, informational, educational resources, which will help us to prevent HIV prevention. We had really great cases on making a chatbot on Telegram, making a TikTok, this kind of organizations like Teenager in Ukraine and all over the different countries, they made online counseling, online sessions, and as well different initiative globally. We should support them more and more. Another thing, what I want really highlight, when someone is asking me what we should do to make sure that young people and adolescents are receiving information, they are testing, they don't have a risky behavior, they are going to test, they are taking PrEP, they are using PEP, they are using condoms, etc., etc. So many demands, right, for young people and adolescents, so many expectations, and usually the programs created by adults. I'm not against adults. We will in one day all become adults. But what I want to say, it's the agenda, the program should be designed, co-led with and by young people as well. That is why we need a youth-centered approach in all our programs. Is it the Global Funds AIDS programs? Is it the WHO program? Whatever programs action is happening, it should be also a youth-centered with and for young people. What do we mean by this? When we are talking about the different initiatives, it's very important also to note that for what campaigns we are creating will be who is our target, and our target most of the time is young people and adolescents. Who knows better, adolescents and young people? Of course, adolescents and young people. So instead of only creating a safe environment, supportive environment, or interactive environment when we are asking someone like to come, young people, to the focus group discussions, to come young people to participate in the survey, to come and do something like in tokenistic way, we should create engaging environment when everyone in this conference could make a step and action to be engaged meaningfully, to say something or to develop, and this is engaging environment. What I really don't like and what I want to show, it's like when people using this, this is very old hard ladder of participation. Look at the date. Date is 1992 today is 2024, and it's still, we are dealing with the same problems. We are dealing with manipulation, we are dealing with tokenism, we are dealing with assigned but not informed. We need the volunteers when we need to organize something, but we don't need volunteers when we need to pay, for example, to develop curricula or to develop content, etc., etc. We need to consult because we need to conduct focus group discussions because it should be also include youth voices, but we are not co-creating together. So that is why this leader's Hart's letter of participation is very showing the steps from where we don't want and where we should also all track and go. It should be, sorry, it's not child initiated, it's youth initiated and shared decision. It's not only about participating as a decoration or something like to fill the place, but we are actually taking steps in this role. Another thing, what I really want to highlight, its importance in our region to integrational service delivery, SRHR package, right? We are talking about HIV. When we talk about HIV, we are not separating it from other topics like contraception, for example, or gender-based violence, or, for example, gynecology or other STIs like and etc. etc. So what we are gonna do is to create this youth-friendly environment where not only HIV services could be taken, but also all the needs of young people and adolescents will be closed in the consultation, in the counseling. And of course, very important part is mental health. What we are doing as a Eurasian coalition, as a regional consortium of regarding this, we are currently developing the CSE guide for LGBT youth, for example, because we understand based on the response of the reports that there are very lack of the materials, and I'm not talking about the English language or Russian language, I'm talking about the national languages, Moldovan, Romanian or other languages in Eastern Europe and Central Asia. We are also currently evaluating the SRHR needs. We have an advocacy in Global Fund Youth Council. We have ICPD, Youth for Health platform. It's a WHO Europe initiative, WHO CSU Commission, UNAIDS, CCM AIDS Conference, and other platforms where we can go. We're also creating a safe space to nurture future leaders and also nurture future activists in order to respond and in order to build and bring really, in order to decrease these numbers at the beginning, all of the presenters showing about the high prevalence of HIV among youth or key population, we should bring them to the table and say, look what we can do together. And of course, we are bringing to them to the CLM. It's a community-led monitoring when we are asking, okay, now we are giving you them, now together we can monitor the progress. Now we can do reports like monitoring, evaluating. Do you like it? You don't like it, etc., etc. And of course, it's a UPRS, a tool for advocacy, universal periodic review for human rights. The previous speaker also talked about the stigma and discrimination. It's so important, and Dr. Iman also mentioned about the strategy of UNAIDS on 10-10-10 on criminalization. Whenever, and this I think my last slide, sorry if I'm almost wrapping up. This is the figure showing how we are dealing today. Like if we don't have access to the services, if we are getting punished because being for ourselves or because searching for HIV services, we cannot talk about decreasing the numbers and epidemic. And it's not about the numbers, right? We are not talking about like success in the numbers. We are talking about people, people's life, and we are talking about us, our generation, our not only the future, but also present. And I want to encourage all of you to build this future together, but not waiting to that mysterious future, but start doing some action from today. Feel free to contact us by email, also looking to the website, and also you can search in Instagram our page. And if you have any questions, please feel free to reach me. Thank you so much.